We're busy every day, trying to make people well, trying to save lives, but there's more we need to think about. What new evidence should we take account of? Are we spending public money wisely? How do we keep patients safe, as well as improve the level of care that we provide? It's not easy, and we want to improve what we do, not stand still, and that's where we need help. Help to ensure we improve, to let us know what evidence to take account of, and to check that we're doing the right thing by our patients.
Healthcare Improvement Scotland is the national body set up to support our healthcare professionals find and use the best advances in medicines, technology and medical practice. We believe that every person in Scotland should receive the best care possible every time they come into contact with our health service. And, as a national body, we help to ensure that every hospital, every GP practice, every clinic improves the care they provide to you and your loved ones. Here's how we work.
Healthcare Improvement Scotland helps us make sense of new evidence and know what evidence is worth putting into practice for the benefit of patients.
They help us to put that evidence to work, helping us to change the way we do things and working with us to get the best results possible.
As patients, how do we know we're getting the best care? Healthcare Improvement Scotland looks at how well care is being delivered and publishes its findings so that we can all see for ourselves.
Every year, around 2 million research papers are published in over 20,000 journals, each highlighting information that could help improve patient care. An average of 80 medicines are launched annually, and there are over 100,000 medical devices currently on the market. How can any healthcare professional even begin to make sense of all this information and decide which advice is worth following, which medicine or new device is worth using, as well as focus on patient care?
Healthcare Improvement Scotland does a lot of the hard work for us. They filter the information contained in research papers, analysing it in order to let us know what works and what we need to be aware of. Their findings are presented to the NHS in Scotland in a way that lets us know which new procedure is worth using, which new medicines and new devices are most effective in helping to improve patient care. This helps me to plan the care of my patients based on the best available evidence.
So we've informed the NHS of the changes they should be making that will result in real improvements to patient care. But how can we put this advice at the fingertips of busy healthcare professionals as and when they need it?
Healthcare Improvement Scotland designed an application that allows us to see the best treatment options for a wide range of conditions just by accessing the free app on any kind of smart device. I don't need to drag a computer to a patient's bedside and wait for it to boot up or drag a document from a shelf and wonder if it's the most up-to-date version. It's all here in front of me. What does this mean for the patient? Speedier decisions about how best to care for them and greater certainty that we're using the best available advice.
But in helping care for patients, very little is free to the NHS. Thinking about how to spend money wisely is a daily concern of every NHS board, GP practice and clinic in the country.
Healthcare Improvement Scotland helps us in this challenge by giving us advice on the clinical and cost effectiveness of new medicines and treatments. This advice is extremely important and supports us in spending public money wisely. In the current financial climate, this advice is invaluable.
Healthcare Improvement Scotland identifies the best advice and presents that advice to the NHS in a way that they can use to better take care of patients. The advice comes from various specialist parts of our organisation, knowledgeable in making the best use of new evidence for patients and helping the NHS to spend money wisely.
Improving patient care is all about changing habits. It's amazing how one small change can make a huge difference. From the evidence Healthcare Improvement Scotland provides, we introduce one small change and make sure it has a positive impact on patient care before rolling it out further. All the time we monitor how well it's working, and we're always looking to make adjustments where we need to. This way of improving patient care, of putting new ideas into practice, has come to us through Healthcare Improvement Scotland. Through support and monitoring, they ensure that we keep moving forwards and keep making changes that will make a real difference to patients.
All our work is built around the patient, improving their health and well-being. We take the best evidence and work with NHS staff to put that evidence into practice for the benefit of the patient. Those changes are all around.
You worry about lots of things when you get into hospital. You worry about infection and bed sores if you're going to be in for some time. You can see the staff are working hard to make sure they do things right and improving what they're doing.
Bed sores are a good example. They can play a key role in patient death and can be hugely expensive to treat. Through a programme of care developed by Healthcare Improvement Scotland, certain hospital wards have gone hundreds of days without any pressure ulcers at all, and the influence of the programme is spreading. Whenever we put a new practice in place that helps improve care, we're proud of the achievement and grateful for all the help we receive, because ultimately it does save lives.
We make sure that evidence leads to improvement. You may not notice us in your hospital or GP surgery or clinic, but advice and expertise from Healthcare Improvement Scotland is helping people to get well every minute of every day in every healthcare setting in Scotland.
I know hospital staff are really busy, but I also want to know that the people I care for are safe in hospital, in an environment that's clean and safe, and their treatment is being delivered the right way. I want to know that there's an organisation that will look after the interests of the people that I care about.
Healthcare Improvement Scotland is that organisation. Is your hospital environment safe? Are staff doing the right things to ensure your well-being? Healthcare Improvement Scotland inspects every hospital in Scotland, as well as private hospitals, hospices and certain clinics, to ensure that your hospital is a safe environment and that patients are being properly looked after. We carry out inspections without prior warning and target areas that matter most to you. And we regularly inspect those hospitals that need to improve the most.
It gives me peace of mind to know there's an organisation out there checking to make sure everything's been done in the right way, and I can read about it and see for myself how the NHS in Scotland is performing.
We're there to help staff improve, but we're also there for you, making sure that your NHS is doing all it can to look after you. And that's how we do it. We gather together the strongest evidence to issue the best advice. We work with NHS Scotland staff to put that advice into practice. And then we check that the advice is being followed and publish our findings.
We believe that every person in Scotland
should receive the best health care possible
every time they come in contact with our health service.
Healthcare Improvement Scotland may not be immediately visible to you in your hospital, your surgery or your clinic, but we play an important role in supporting the service to deliver improvements in patient care. Working together, we can ensure continuous improvement in healthcare in Scotland.